guys, it's Dave. Today we're going to be talking about alopecia. I know, good topic for me, got very little up on top. However, the alopecia that we're talking about today is going to be areata. This can affect people mainly before the age of 30. However, it does affect anyone, men, women, children, middle age to older age. All races are affected by it. It actually is an autoimmune disorder with some genetic components to it. So if you happen to have a direct relative that either has this or something like lupus or rheumatoid arthritis or a thyroid disorder, you will be more prone to having it. It's a situation where your hair will fall out in patches, and they can be anywhere from a dime up to a dollar-sized patch. And it generally starts out on the scalp, but it can move to other areas of the body as well. If your entire scalp, if all the hair falls off your entire scalp, it's called alopecia totalis. When it falls out from all parts of your body, your hair, your scalp, your eyebrows, your arms, your legs, that kind of thing, it's alopecia universalis. There is no cure for this disease. However, there are some treatments that have some impact. Not generally, they don't work on everybody, and a lot of the times they don't do, it can come back on you. They can be treated with corticosteroids, either topically, orally, or you can have injections as well. Minoxidil, mainly in the form of like a shampoo or a rinse like Rogaine, is used. Anthralin, DPCP is also used. However, what happens is it doesn't necessarily stop new patches from forming. It helps with the patches once they've actually occurred. And just so you know, if you do happen to have hair that comes back in, it can be a different color. Usually you'll see in a lot of cases it'll come back in lighter or even white. Something else that they're trying to try out too is phytochemotherapy, which is treatment using UV light, very strong UV light in fact. It again has had moderate results. It's not a cure, it's just another treatment that they're trying out. You can, something else that you can see is if you're African American, you will have a higher likelihood to have this, as well as Hispanic females. For some reason, not so much in the males as much as in the females, can see this disease more pronounced. And what does occur, in case you have this happen to you or a family member or friend, there will be burning sensation, itching in the area prior to the hair falling out. Then, over a period of days to weeks, it does happen fairly rapid, the hair will fall out in the clumps. Like I said, they can be anywhere from a dime on up to a silver dollar size in that area, and the hair will fall out. The thing about it is, the follicles themselves, the hair follicles, aren't destroyed. That's why hair can grow back, because the follicles aren't destroyed. But the follicle will only allow hair to come back if the inflammation in the follicle goes down or subsides, which is why some of the treatments with the corticosteroids has worked or helped, because they decrease inflammation. Patients with just a few patches that occur can experience a full recovery without any treatment, and that does happen quite often. 30% though of patients will find more extensive loss of hair as it progresses, and eventually will either see totalis or the universalis, where you lose all body hair throughout or over your whole body. 10% actually will develop losing your entire body hair into totalis. Just so you know, you can also see differences in your nails too. You can see pitting, white lines or dots. because your hair and your nails are made up of the same kind of material, working on the same type of cells, so you can see that as well. It usually is not a serious condition. However, there is situations where most people will have anxiety, depression, and obesity too, because you're not feeling like exercising, you're not feeling like getting out in public, going for walks, doing fun things, so you are more prone to these things. There are some great support groups out there, and I highly suggest, if you or a family member has this disease or a friend, that you get in touch with some of those support groups. The Children's Alopecia Project is a great one that's out there. I have a friend that actually has a child that has this disease. So I went to her and I asked her if she could give me something that she would like people to know. Because let's face it, if you see somebody that's different, you wonder what's going on. You may stare, you may not understand. I'm guilty of it too. And I don't care what it is, if it's a disease state or somebody in a wheelchair or maybe somebody who's lost a limb. We all have that look and we all are curious about what's going on. Well, what my friend said is she wants her child to be known for who they are, not for the kid with alopecia. And that's important because with alopecia, it's very easy to differentiate that person. You know, oh, that's the guy with alopecia. Where if you're a diabetic or you have high blood pressure or you're an epileptic, unless you go into a diabetic coma or a seizure or have a stroke or a heart attack, you're a silent person with that disease. So you're not Joe who's the diabetic or Sally who has high blood pressure. You're just Joe and Sally. And so she wanted to know, or she wanted to let it be known that it's not the person with alopecia, it's the person for who they are. It's just unfortunate that they have alopecia. But I highly suggest, if you know somebody who has this or you yourself do have this as well, reach out to a support group. And something else, also remember, you're going to be more prone to experience sunburns now because your hair is actually a blockade to prevent sunburns and to protect your skin from the sun. So don't hesitate to get in to see some cool hats, some cool scarves, some coverings for your arms and legs that maybe you wouldn't have in the past. Hey guys, this is a PS or an addition at the ending of our video regarding alopecia. Since the time we recorded that, there now has been approved a new oral once-a-day treatment for patients that are 12 years or older that qualify, called Litfulo. Again, they are seeing some very good results with it. It is pretty pricey. You want to talk to your provider if you would be a patient that would qualify, and then you would want to get checked to make sure it does go through your insurance and your out-of-pocket costs. But there has been some exciting results from that. So if you would qualify, you may want to check that out.